Okay, good morning. Today is March 28th, 2023, and this is a meeting of the Boulder County Regional Opioid Council. We've got an agenda this morning that I think all of us received in advance, and I'm going to just go ahead and kick it off over to Kelly to take the first two items. Robin, is there any reason for everybody to identify themselves as present at this time?
No, I think we can capture who's on screen, and
I'm just wondering if we need any official minutes of who was present. So if not, then let's go ahead, Kelly. Thanks.
Awesome. Thanks so much, Claire. So let's go ahead and dive in with a quick agenda recap. So first and foremost, our virtual meeting guidelines. As a reminder, members of the public are invited to today's meeting. However, this is not a public hearing, so we do ask that members of the public in attendance keep their microphones and their cameras off. If you do have pressing comments, questions, concerns, you are welcomed to add them to the chat. However, they will not be followed up in the course of today's conversation by council members. So our agenda for today, we're going to start with a milestone calendar, which is really to just sort of give a snapshot of what we know in terms of this fund distribution process, kind of the bones of what we've identified in this first year as our major milestones, and then a little bit more of the processes between those milestones. I will be talking about the responses that we received from a recent request for proposal that we put out for facilitation and evaluation assistance. We'll switch gears, and Robin will be leading us through a conversation about resource distribution, primarily whether there are specific pros, cons, or priorities around doing a direct funding cycle versus a competitive bid cycle in this next round. We'll also be talking about a wastewater fentanyl project, which was a priority project brought forward by one of our commissioners. And then we'll close out with other items and reminders of next steps that are good for the group. So that said, first up, our annual timeline. And really, this is just an acknowledgement that, you know, in our first year, there was kind of a strong learning curve. We were really trying to figure out what our major milestones were, what our due dates were back to the state, what our processes back to the state were, and how to sort of fold in our process of identifying priorities and relevant programming across that annual timeline. And so this is just to sort of provide the group a little bit of an understanding of what we've determined are kind of the guideposts along the way. We do know our general funding timeline. Within that, we have a lot of process pieces that we're still really trying to figure out that can sort of shift our timeline from when we know we have funds to when they actually land in the hands of some of the programs that are funded. So what we do need to still determine are strategic priorities. You've heard us talk a lot about that. It is one of the primary areas that the request for proposal was put out for assistance in helping to facilitate that process. Our funding process, we're going to talk a little bit today about direct versus competitive funding processes, and they do have different corresponding lengths of time. So making one of those decisions early could send kind of our subsequent timeline in one of two different directions. We know that we do want to hold space for priorities that are designated directly by county or municipality leadership. And so what does it look like to really integrate those priorities to sort of the broader process that's underway within our operations group and some of the community processes that will be underway with this RFP effort? Full settlement amounts are constantly sort of shifting. And so we do have an understanding of our baseline of funds that are due to the region on an annual basis. However, there's a little bit of flex in those dollars. If you can recall, all of the municipalities were given an opportunity to opt in, and which means pool their funds into the regional share, which then kicked that regional share number up. Or they have the option to opt out and keep their local share of dollars, which would bring that regional pool of dollars down. That is an annual decision that municipalities can make on an ongoing basis. And so, you know, while we do have that baseline of funds that we know are coming to the region, there's a little bit of wiggle room in each direction that we're just trying to plan around as we're, you know, in real time, also figuring out our priorities and programs. and then our structure for phasing in and out new programs. So we've heard loud and clear from the regional council in the past that we're concerned about sustainability. We want to make sure that any of the programs we bring on are not planning on these dollars to be sustained on an ongoing basis, and that we do allow ourselves the opportunity, sort of on ramps and off ramps, to make this process iterative, to make sure that we're allowing space for new sort of aspirational programs to come in, and similarly to maybe move out or sunset programs that have funding today, but maybe in another year or two might not be the most appropriate fit, either because they've reached their goals or maybe they don't really align with sort of the network of strategies that we have, whatever those reasons might be, just allowing a mechanism to really move programs off of that funding stream. So what this looks like in terms of a timeline, again, we do have those firm kind of guideposts in mind. Every September, we know that we'll be receiving notice of how much funding is coming to the region. So we will be aware of that baseline regional share of dollars. And then every December, we need to submit our plan to COAC, the AG's office at the state level, to say how we intend to use those dollars. So if you can recall from this year's process, that was where we went in that cost system online, and we allocated dollars across 3 different categories. So that would be done every December, with the slight caveat there being that we do have an amendment period in March, the following March, to sort of shift some of those dollars among the different categories, or if we had decided in December to not draw down all of our dollars in one lump sum and we actually saved some, we can go back in that March amendment period and say, okay, now we have an additional plan to allocate some of those remaining dollars. So that's sort of the wiggle room that's allowed until March of every year. And then we also know that in Q1 of the following year, we'll start to release those funds to the respective programs. So within those milestones, we have a couple priority processes, some of which I've already mentioned in that last slide. Before September, when we really have an understanding of that dollar amount, we really want to have our strategic priorities set so that we're ready to go. We know exactly, how we want to dedicate these dollars, whatever that number might be. We also want to have some sort of a leaning towards the application process, direct or competitive, and we'll talk about that later today. Also, an answer to the question of claiming all of our funds. So this is really something that allows us a bit of strategic wiggle room, in that we can say, maybe we want to draw down X number of dollars, but keep certain dollars to sort of move and sort of revisit our planning process at a later date by that March period. And so that's a bit of a strategy there. We could also, as dollars roll into subsequent years, that allows us the opportunity to say, maybe we want to not hold or pull down all of our dollars this year, and we actually want to put, more in the pot for next year and have a bigger, broader plan that brings on, more programming in a subsequent year. So that allows us that little bit of flex and wiggle room in our strategy. Similarly, annual or multi-year contracts. So this year we did make the decision to go with annual contracts. Those 25 shovel-ready programs are receiving their funds on an annual basis. But just knowing and seeing now how much process pieces, capacity has sort of gone into this, it might make more sense for everyone's bandwidth and for the process pieces to kind of play out over a longer arc. And so maybe it makes sense for us to award multiple year contracts instead of annual contracts. So some of those pieces being weighted before September. In December, submitting the plan, having the plan approved, and really beginning that contracting process with the county. And then in Q1, really the process pieces become a little bit more internal and staff oriented. So the funds will be distributed, and then processes need to be in place for the ongoing reporting elements back to the county from recipient programs, as well as expenditure reporting. So this is a little bit just kind of an FYI to provide some structure on what has at times seemed a little bit, up in the air in terms of structure of this process in year one. And so no real request for any specific questions here, but of course, if there's feedback or any comments from the council, we just want to pause and welcome that.
I'm going to suggest that people just go ahead and jump in and that we not use the raise hand function, just because I don't have enough space on my screen to see everybody's hands.
I'm happy to jump in with a quick comment and just wanted to say, Kelly, I just really appreciate the notion of multi-year contracts because it is hard for programs to get up and running and off the ground with enough data to support it in an annual process. And as long as there's some evaluation along the way, I think that's a really smart suggestion as we're continuing to move forward.
That's great, thank you. I think from a staff perspective too, that longer arc of this process is, that could be really rewarding in terms of capacity and bandwidth, because you have the ability to really review these in a more meaningful way. And sort of as you're moving forward, there's not just a constant new timeline kind of upon you already. So that's good to hear some support for that. Yep. Any other questions or comments?
Kelly, just a question for clarification. I'm sorry, Claire, do you want to go first?
Oh, no, go ahead. I can wait.
Okay. Given that we may obviously have some competitive bidding, can you, and I'm sorry if I missed this, but can you explain a little bit where that fits into the timeline? Would the planning start well before September?
Yeah, and we are going to have conversations about kind of the pros and cons of competitive versus direct. So where it would fit in the timeline, we do know that competitive bid process would take longer than our direct funding process that we did in this round. So we would have to back that up before September to say, you know, okay, we have to put out RFPs, which means if we're putting out RFPs, then we have to move those, you know, strategic priorities up higher in the timeline so that we have it identified, put in the RFP, leave time for us to sort of grade those RFPs. So that is, again, you know, a critical decision because it sort of backs up every preceding decision before it.
Thanks, that's helpful. That's what I wanted to know.
Yeah, my question was around developing the strategic priorities and having that ready. Are we expecting that work to primarily be done by the working group, or are we building that into our meetings?
So in my mind, it's a both and. So, you know, we're really anxious to get this facilitator kind of on board, and our timeline is really hoping to have them on board and do an initial kind of kickoff with staff in the operation group by end of April or early May. And they're really going to help us facilitate that process. The strategic priorities are something that I see as sort of a pinging back and forth from, you know, what comes out of that operations group moving forward to this group for advancement, additional question, comment, digging into. So I see it as sort of a both and process, in sort of similar to the way that we've sort of pinged our conversations off of the ops group to the regional council respectively in this last 6 months or so.
Okay, thanks.
Any other questions or comments before I move us ahead here?
Kelly, I would just like to add that, as we know with establishing strategic priorities, that we're really in a dynamic and evolving environment, especially in the behavioral and substance use world. And so if we can focus on a lens of both and know that we may need to pivot, or there may be an emerging issue that would come to the board that would be a new priority. So just to have some tolerance for that.
That's great. Thanks, Robin. All right. So switching gears just a little bit, I know I've kind of queued this up already, but I did want to give kind of a snapshot of what we received in terms of responses to our request for proposal. So just a quick reminder, the main goals of this request was first to provide support to the Opioid Operations Board in their efforts to develop a comprehensive plan for use of the settlement dollars. And then the second component of the RFP was really evaluation focused. So develop and implement a long-term evaluation plan to assist in measuring both the effectiveness of each respective program, but also the programs as a whole, as sort of a suite or network of programs intended to make a broader impact at the regional level. And applicants were invited to respond to either one or both of those components, the facilitation and the evaluation. We received 6 responses, so they're listed here. I thought I hyperlinked them as well in case folks wanted to review these slides and maybe dig around to learn a little bit more about the organizations, but I'm happy to get those links to folks if they're interested. And this was the initial scoring criteria that we weighted these agencies against. So, you know, we had all of these weights are actually weighted the exact same amount in the RFP. This is the exact scoring matrix included in that document. But we did have an exercise recently in our operations group just to say, just a quick Mentimeter, you know, checking the temperature to say, are any of these a higher criteria in priority than others? Should some of the scoring be close between our finalists, just knowing the sort of insights from the operations group to say, you know, this is really a way more important criteria to us than perhaps this other element. And so probably no surprise, the weighting came out that providing similar facilitation services and planning services, so those top 2 were of top priority to the operations group members, and the lowest priority was the budget reasonableness. So again, just sort of something for us to keep in mind as we revisit scoring and sort of integrate you know, the feedback of possible tiebreakers in terms of weighting this criteria. So I'm going to talk about the pros and cons that we saw come out of our applications, really what made certain applications stronger for us than others. This is not about one particular organization. Again, this is really generalized pros and cons of what we saw. In our stronger responses to the application, we saw a strong application of equity principles, strong emphasis on utilizing data to ensure inclusion across all impacted populations. So, you know, organizations noting that they need to look at XYZ data components to make sure that they have the right folks at the table from those most impacted communities. Strong applicants also mentioned really granular level breakdowns of the facilitation process, how they would approach it, the specific tools they would use, the specific iterative process, methodology. Some even mentioned, or excuse me, outlined an exact meeting timeline and the relevant objectives, backing out of that, you know, September, December timeline that I just mentioned in terms of when we need to have our plan into the state, backing out of that and notating what exactly we need to talk about and settle within each subsequent operations group meeting. So that was really helpful from my perspective, at least, to get an understanding of, you know, what we would be tackling and when along the way. The strongest applicants, of course, exhibited a strong contextual awareness of opioid abatement, both at the Colorado state level and the national level. And then stronger experience in the SUD or OUD space or care continuum across harm reduction, prevention, et cetera, all the way through to treatment and recovery. And then also strong applicants mentioned how they would engage across particular barriers and access issues for all populations. So some spoke to how they would tackle the digital divide and language barriers, offering translation services and community convenings, and also an acknowledgement of the different power dynamics that would sort of be at play within some of these conversations and their methods to sort of approach that from the very beginning and break down those power dynamics so that all participants felt equal access to the conversation. Some of the cons we saw across applications, unfortunately, there was one agency that was local, but the rest were out of state, which, you know, we thought was a little bit of a bummer. We did want to see, especially because there's going to be so much community engagement in this process. We did want to see that local, you know, connectivity to the players in the communities within our region. Some of them did have good experience to speak to, but maybe not so much in the space of public health or government or SUD and OUD. Some of them had, you know, more of an emphasis on acute care systems or policy level decisions. And so while good experience, the contextual piece was missing in some of those applications. And then specifically, we saw that not many had strong examples of how they would utilize data. A lot of them mentioned what data sources they would lean on, but not how that would be integrated, especially when it came to evaluating programs. I'm going to pause here actually before I keep going and see if there's any questions or concerns or comments. And I'm happy to get these RFPs out to the full group as well. I'll talk a little bit more about our process moving forward with these. Just gonna minimize that there. So our process today, really, we took those initial 6 agencies. Staff did take the first sort of run through of these 6 RFP responses, and were able to unanimously agree that 2 of the agencies were not as strong as the others. So those 2 were eliminated. Those 4 remaining agencies were brought forward to the operations group in summary format. So wanted to note that what the operations group saw was a similar pros and cons breakdown, but it was more specific to each of those remaining 4 agencies. At this time, there's no official ops group recommendation. So what we did identify in our meeting on Thursday was the questions that members would like to see forwarded to an additional round of interviews for these finalist agencies, and then have ops group provided one more additional opportunity to participate sort of in a deeper capacity by being present in those finalist interviews should they want to be. So kind of moving us a little bit more in the direction of getting an official recommendation from the operations group. In our meeting on Thursday, we did ask the ops group members, what are the questions that you'd want to see these organizations expand on? 3 that came forward loud and clear is what's the intention for local presence? So as you heard me say, none of them are local. And you know, in that same way, we didn't see in the budgets a travel line included in many of the non-local agencies. So we just wanted to hear them voice what their sort of intention or expectation might be for being in person for many of these pieces that we strongly feel should be held in person. Wanted to hear more about evaluation of programs as well as the full impact. So it seemed like some of the applicants spoke a little bit more to one than the other. And we know that we really want to get an evaluation of both those programs and full impact. And then we also heard loud and clear that we'd like to know more about the staff that's going to be dedicated to each portion of the work and what is their relevant expertise in similar bodies of work. So I'm going to pause there and sort of put the same question out to regional group members and just ask if there was specific questions or additional content that you would like to hear more of the applicants expand upon, and just sort of note that here.
Well, Kelly, I guess the question, I'm sorry, it was somebody
No,
else.
go ahead.
Just the question jumping out at me with the dearth of local respondents is whether they're intending, maybe you said this, but are they intending to do most of this then digitally, remotely, on screen?
Right. Yeah, so getting a little bit more clarity of how they intend to kind of break that down and how and to what extent do they expect to be local. Definitely want to dig into that. That's great. Thank you.
Yeah, and just, I mean, it's concerning. I guess there's nothing we can do about it. Because, you know, along with that, they're not going to have a lot of familiarity with any Colorado specific context. And maybe there's an assumption that the crisis and the consequences and the impacts are consistent across the country, but I don't think that's really the case.
Right. So what is their plan to sort of localize their understanding of the context? Yeah.
Yeah.
Okay.
I appreciate that because I have concerns about that as well, although I think that depending on what their response is, I think they can overcome that if they are planning to be more direct. I think all virtual is going to be a problem as we're thinking about bridging trust with potential participants and the engagement that is anticipated. So with that, I think the staff expertise, not just in the similar work, but frankly in relationship to relating to and incorporating diverse perspectives from a variety of potential participants, sort of the equity question of how are we engaging, and are we engaging multilingually? Are we engaging, how are we engaging with folks who are unhoused? How are we engaging with folks that may come from different social and economic backgrounds and may have different trust with government. So just those thoughtful questions, and I'm sure that you all are thinking about them. I'd be curious to know more about.
Yeah, that's great. Thank you. Any other kind of questions or topics in general that you'd like to see a little bit more elaboration on from some of our finalists as we go into these interviews?
Kelly, what was there a part of the process where people who were considering applying could ask questions?
Yes, there was. So I believe the lead time between the release of the RFP and the due date for those initial questions was, I believe, about 10 days. And that was after that question period closed, there was an additional, I think about 3 weeks to the final submission due date. And I can get that exact timeline. Those dates are a little bit fuzzy in my head right now, but I know there was a question period.
I'm just curious if there was a trend to the questions that would give us more information about why people didn't submit applications. I think as a county, we're looking at this question more broadly about barriers to access a partnership with the county or bid for a contract or an RFP. So anything that we can learn from your process, if there is, and there may not be, that would be helpful.
Yeah, that's a great point. I know we have the summary of those questions. The way that they come to us, they're a little bit, they're randomized. So I can't tell if certain questions are being asked all from like one agent, you know, if there's 15 questions, I can't tell if 14 are from one agency and one from another, or, you know, from all over the place. But I think I can definitely get more detail and to look to see if there's some trends in some of those questions. That's a great idea. Thanks. Other comments? Are there other processes you'd like to see in place? And maybe I'll just also open up to that last question on staff process in these decisions moving forward. So, you know, this was sort of our first round of trying to really take a key decision point and integrate or weave together the process of staff work, the operations group feedback, the regional councils feedback as well. What's standing out for you in terms of what worked or what we could expand on in subsequent processes, and where the staff sort of decisionality lies on that? Excuse me.
Kelly, can I take us back again to the previous
Sure.
question about additional questions? I think
Sure.
I'm thinking about what Robin said at the outset, that we need to keep in mind that this is really an evolving crisis, and you know, our responses, our understanding of it is evolving. The responses will be evolving. I think an additional question would be, how would they propose that we develop a set of criteria, priorities, while at the same time leaving room to modify those as conditions change, you know, over the course of the years in which we're going to be expending these funds.
Yeah, and I think that's actually a great question for the operations group to dive into as well. You know, I think looking at just the way this last year has gone, kind of talking through that milestone calendar earlier, it's been, you know, a lot of the targets and timelines have seemed so up and down and kind of confusing to an extent. And of course, that's just kind of the learning curve of year one. But I do really, you know, acknowledge that it would be great to have in our strategic framework those kind of on and off ramps of when are we revisiting certain decisions and what mechanisms do we have in place to make this an ongoing iterative process to allow for that natural evolution. That's great. Thank you. Any other questions either to bring forward to the finalists, or any comments about staff process in these decisions moving forward? Does the regional council, how do I want to say this? Is there sort of a priority one way or the other if we take this as a staff process from here with these finalists, interviews, and then select an applicant? Or would this be something the regional council wants to review in another meeting to say yes or no to whomever we kind of identify?
I would support the operations group just moving forward with a selection.
I agree.
Yeah, I have no problem with that either. I would hope that once that selection is happening, that we would then get information about it and perhaps some of the reasoning behind it. So, and if you want a support of that, then let us know.
Absolutely, that's super helpful. Thanks.
And maybe I'll suggest if anybody has concerns about that, to go ahead and speak up now. So I don't see anybody unmuting. Great.
All right. Sounds good. Well, I will move us forward then, and I will hand off to Robin to get us started on resource distribution. And Robin, I'll just continue to advance this. So just
Thank
ping
you.
me when you want.
So as Kelly introduced, I think, and we've had bits and pieces of this conversation in past meetings, but in terms of, our strategy overall, in terms of investing these dollars in community, what we started with was existing programs. We wanted to get money out quickly, and as well as really engage providers and community members and our staff experts in that process. We have options going forward in terms of, do we continue with more of a direct funding approach? And Kelly outlined some of the cons of that in terms of, or the cons of a competitive process. And so we just wanted to have this conversation with you all. And I want to name that for our council's evolution, I think this can help us clarify what is the council's purview versus the ops board purview, and in terms of decision-making authority. I think it's clear that final approval of funds that are going out does belong to this board, but how we get there, I hope we can have a conversation about that can then lend itself to understanding future decisions that the council will be making, or as we just did with the facilitator, say to staff, this is your within your scope of decision-making authority. So I think we all have experience with different funding processes. Many of the ARPA funds that went out were more of that direct funding approach, preceded by extensive community engagement. And those dollars were fairly big lift for staff to get out, as well as agencies to respond to in terms of contracting. The downside of that, from my perspective, is that you don't know who's out there. That might be a really key player, or a disparately impacted group or population or agency that's not often invited to the table. And as we just talked about, sometimes there are even barriers, even if people know about a funding availability. So those are all layers to this conversation. So I'll pause there. I'd be interested in us diving in more into this conversation. And, we can certainly do a both-and approach. We would want to make sure that we're communicating what is the approach so that people don't get confused, as well as the timeline and the requirements. Or we can, we can shift gears. Any decision that we make today doesn't have to be static, and we can certainly pivot. So I'll just stop there, just sort of teeing up the question to the board and seeing what your overall thoughts are.
I'm happy to weigh in, Claire, if you need a starter.
Yeah.
And I'll say I'm a little conflicted about the question only because it feels a little cart before the horse, right? Like it may depend on what we're going to use those monies for. Like I get that a competitive approach adds time to it, but it also adds transparency, and it adds, to your point, Robin, an invitation to others that won't normally be at the table, and sort of allows for that exploration. But there are also situations where we know through data and through the work that's currently ongoing that we want to expand an existing program. And that seems like a situation where it's performative almost to have an open bidding process when we know that we really want to extend something that works. So it to me, it just kind of depends on what the projects are. And I feel like it's going to be a little bit of a both and, because I don't know how to get through the barriers to knowledge and the invitation and the transparency aspect if we don't do some of the competitive process.
Thank you for that.
Yeah, I would agree with what Nuria said. I think a both and approach is important. I think through evaluation and outcomes, being able to determine if we want to scale a certain program feels important, and we wouldn't necessarily want to do a competitive process for that. And I really like being able to do a competitive process. There might be providers that we're not aware of or services that we aren't aware of. The question I would have about that is, and we're talking about this in other areas of contracting, have we talked about carving out any funds, or is it even allowable to have funds or capacity that can help smaller providers who may not have capacity to do some of the outcome tracking or some of the financial tracking that would be needed for the grant money coming to them. So just a thought about that on, how do we make sure that we're attracting providers that are going to serve the communities we're really trying to reach that may not have the infrastructure to be able to do this. So that would be my only question about whether it's directed funding or competitive.
Yeah, that's really helpful. As you know, we do have a 10% admin that we can use for that sort of work. And frankly, we're looking at that already because of the burden of asking our existing contracts and fiscal staff to manage an additional 25 grants that we just recently went through. But I think it's a really good question. And Susan, maybe we can, for those of us who are looking at this technical assistance piece, maybe we can combine efforts and provide that assistance collectively.
And this is a little bit ahead too, but just would want to also talk about what, if any, barriers the team is seeing to contracting because of insurance requirements or things like that. So we'd want to make sure we're barrier busting around that as well.
I think the only thing I want to add, and I agree with everything that's been said, both and, because we'll have to see what we're looking at. And in some areas, it may be very obvious that there is a perfect fit with a provider. And so, I'm not going to restate all of that. The only thing I wanted to add here is on the amount of time it takes to complete the competitive bidding process. And the concern for me, this is so urgent to get these funds out, to start seeing them produce results. And I just feel that urgency. And so I do want to, I'm thinking about ARPA and some of our ARPA funds that, we're not seeing yet out in the community. ARPA, that's right. So I just have that in mind. It's weighing very heavily on me.
I'll add, because I think it's relevant, is You know, we do have other funds where decisions are made to take a certain amount off the top of the funds and have that be directed funding to programs that we know are working. Or as we segue into the next subject on the agenda is, you know, there may be a priority, you know, for a municipality where a municipal leader might want to come forward and say, you know, the city of Boulder would like this amount of money for this project. And so, you know, to make space for an amount of funding that is direct and then amount of funding that is competitive. And maybe that makes it too structured to do a specific percent. But if the board's interested in us exploring that, we could play around with those numbers and what that might look like. Any other input from folks who haven't chimed in? Watch out, I might call on you.
There we
I'll
go.
speak. I'm in agreement. I agree. We need to be flexible, nimble, and look at all the opportunities. So I'm good. Nuria stole my words. First up. It's all good.
Thank you, Curtis.
This is what you get when you jump in first, Curtis. Next time it's on you.
So Miranda, we're not hearing you. It may be, yeah, it looks maybe a microphone. You could use the chat, or we can move on and then come back.
So Miranda chatted, she agrees with what everyone said so far.
There we go. There we go. Okay, great.
And I think number 3 falls into this matter as well. And we talked about it previously too, in terms of whether to do annual cycles or multiple year projects. And so what I'm hearing from the council is, you know, flexibility is important. It really depends on what program, agency, you know, stakeholder, constituent that we're working with, and how do we make that work. And again, those decisions, overall decisions, would come back to the board. So if flexibility is the name of the game and the ability to pivot, and Kelly, I'll ask you from your perspective as someone who has to manage this, I think that makes your life more difficult and staff's life more difficult, but do you see any barriers in this approach?
No, and I mean, I see all of the benefits that folks have voiced in terms of needing to sort of know what's working, what's not, you know, what are the agencies that we're not reaching and how can we do that via a competitive process. So, you know, I sort of agree with the direction that the board is going in terms of this both and flexibility. I think I would, you know, want to sit back and kind of go through in my mind what that might look like, but I don't see any major barrier right now. And I think in terms of the annual cycles versus the multiple year cycles, one other thing that comes to mind for me is that's really going to be guided by our strategic priorities as well, right? Because if there are projects that are specifically aiming to move the needle on one of the major priorities we have, but we also know that the needle on said priority can't realistically be moved in an annual basis, you know, that's all the more reason to allow for some of those projects to really kind of prove their outcomes and impact over a longer arc of time. So it kind of all goes back to that strategic priority setting, and then some of these both ands kind of splitting off from that.
Yeah, it's a really good point that we need to weave this all together and connect the dots. Lexi, if I may ask you a question, does this approach impact your first question about the timing and wanting to make sure that we're paying attention to that?
So, yeah, so I think this has been really helpful. It does feel like we're going to want to move conversations about what the priorities are before September, but that probably also fits nicely with, you know, one of our other initiatives around developing the behavioral health roadmap and some community engagement work. So I think it'll start to click and fit together over the summer as what it looks like to me.
Any other comments, or Kelly, is there something that we didn't get to that you were hoping to hear from the board?
No, this is great. I think it's, in my mind, kind of pinging my next step to sort of map this out, that timeline of obviously all of this coming back to those strategic priorities being sort of the foundation, and then the various routes that we can kind of take the funding process and the kind of annual or multi-year contracts from there. So this is super helpful for me. Thank you.
All right, okay, to move on. So this is a topic that there's been a couple different conversations within the county with different folks and with folks way more expertise than I do. But Commissioner Stoltzman was making the observation that during the COVID testing, there was a group that learned that there was a similar process for testing for fentanyl. And at one point, that testing was done, and at a point in time, the city of Louisville had the highest percentage of fentanyl in their wastewater. And so she brought forward the question about, would this be a helpful metric for the opioid work, as well as a desire to use the information to push out public messaging and you know, formalized campaigns, or do some specific outreach to areas that had more fentanyl in their wastewater. I think the issue that we're faced with in the current environment is that it's my understanding that fentanyl is everywhere, and there's high levels due to other drugs being laced with fentanyl. We don't have a whole lot of information to present with you today. I think the question for you is this something that you'd like staff to explore and bring back a proposal? Before we go there, I know, Lexi, your staff has been very engaged in this conversation and has sort of made some really important points that I'd like the board to hear before we have a discussion, if that's okay with you, Lexi.
And let me jump in because I really do want to hear what Lexi has to say. I just want to make it clear that this has not been identified as a Board of County Commissioners interest. This is an individual commissioner interest.
Thank you for that, Claire.
Sure. So this is something that we have considered. Just to be clear, Boulder County Public Health does not do wastewater testing. This would be based in the municipal wastewater treatment facilities. During COVID, the work was coordinated through the state, and Boulder County Public Health really just received the data. And we used that data to identify kind of just-in-time predictions of where outbreaks might happen and where mitigation efforts weren't working. So for instance, when we had the CU outbreak in September of 2020, that we were able to, you know, that kind of wastewater testing is helpful then. And we were able to trace afterwards kind of how CU was doing in terms of containment, because it's a communicable disease. So fentanyl is a bit different. It's not a communicable disease. And the purpose of wastewater testing in this context would really be to say, where are we seeing use? And Boulder County Public Health is working with the Sheriff's Department, the DA's office, and a broad group to implement an alternative strategy to get a handle on where we're seeing use that uses a tool called ODMAP. Historically, we've had trouble getting information on where overdoses were occurring, particularly deaths, because there was a long lag period from the coroner's office. And so we would learn way after the event. And this mapping tool will actually give us much more just-in-time kind of information about where we're seeing use and overdoses in the county. That seems like a big advantage to us. We're not clear on how testing the wastewater specifically is going to give us specific enough information that would be beneficial above and beyond ODMAP. So happy to explore it more, but just wanted to give you kind of that background around kind of what we have been working on and why we see it as an advantage.
Thanks, Lexi. Any questions for Lexi, or anyone have any other questions or comments?
I don't have any questions for Lexi, but Mike, maybe it's a follow-up on something she said just around kind of how it would be used. I think if the ops group was able to explore that and find out if other cities are using this testing and what are they doing with the results, how are they providing education or response based on the results, I think would be helpful information for me.
Yeah, this has not gone to the ops board, Susan.
Okay.
Raises a process question that you see on the slide is, when we do get individual requests from various levels of leadership, how do we process that? Does it automatically go to the ops board, or do we bring it here first you say, yes, we'd like you to explore this, as opposed to before making a decision? And knowing that,
I think it's, oh, sorry, Robin, go ahead.
Well, I think, for instance, I really appreciated Lexi reaching out at the same time that we were putting the agenda together, because I didn't know that Lexi already had a group working on this. So it's just, there's a process question there, and then there's a specific question about this request and what we should do. And again, I recognize that you don't have the full information about what this would look like, and we can certainly get that and bring that back to you, or send it out to you.
So,
Yeah, I think just to follow up, I think it's interesting. I just would like more information about it. I think I'm equating it a little bit to some of the GIS mapping that we're doing around social vulnerability, and that if we are able to isolate communities or zip codes where there's a higher incidence of fentanyl use or overdose, I mean, is there a response we could have, or a coordinated response? I don't know the answer to that, but I think I would like more information if possible.
And I just wanted to point out that Miranda put an observation in the chat about the personnel it would take from each of the municipalities and their wastewater treatment systems to be at the table to participate in this, so that everybody can read that themselves. I think that's an important consideration. And I think what I would wonder is how granular would this information be? To me, it's going to be useful if it does what it sounds like ODMAP does, which is tell us where are people using and where are they unfortunately overdosing, so that we know where to focus harm reduction and efforts. But yeah, so I think maybe we still have some questions about whether this would be useful. I'm hearing Lexi say that they've got tools in place that may actually give us what we want. I guess I'd just like to know whether there are things that we're not hearing about. And Lexi's got her hand up again.
Yeah, just to clarify your question, Claire, so part of the challenge of wastewater treatment is it doesn't give you very specific information. The ODMAP will identify specific places where overdoses have happened, where naloxone has been used. It'll give you counts, like person case numbers, which wastewater testing can't. Wastewater testing can't distinguish between, for instance, someone who has urinated out fentanyl from legitimate hospital use to someone flushing pills down the toilet. Can't distinguish that, can't give you person counts. So that's one of the distinguishing characteristics.
And Lexi, it's also just focused on overdoses as opposed to use. Is it?
The OD map is focused on, use of naloxone, tracking of use of naloxone for overdoses or cases that have been called into law enforcement or other sources for overdose response, cases called into hospitals, as well as real-time information on any deaths. So it does give you that kind of granular information, but it is more in the outcome impact of overdoses than generally used. So that's a good distinguishing characteristic of the two also. And I think it's a really good question about whether the wastewater testing is being used in other jurisdictions for fentanyl testing. I think we could learn a lot from that about whether it makes sense for us, whether it would give us additional useful information or not, as well as, the cost.
So I'll jump in. I'll say I'm really persuaded by what Lexi is sharing with us, right? Like I'm always curious about new requests and thinking about it. Certainly, I know my team doesn't currently test for fentanyl, but in the past we have sampled and sent something out if we had suspected, cocaine or heroin, for example, in the past. But I am persuaded, if this is not the best way to do something else, and would be, I think your question, Claire, is the most interesting one, not necessarily for this. I think we can get good information from Lexi, you and your teams, and I would rely on your expertise about how you think we should go about it. But I am mostly perhaps thinking about the process, because I don't know about you all, but I know when we were dealing with COVID, when it first started and I was in Austin, we had a million different ideas by a million different people that sent staff in a million different rabbit holes and this time suck, right? And so curious about what process do we set up to not have people based on a singular question go down huge amounts of work that could be better spent elsewhere. So the process question to me, I think is important. And where does that come from, right? Is it, I don't know that I as a board member, unless I heard, for example, today, Lexi say, we've got another alternative that may actually be more useful than what wastewater testing done, that I would have known that. So some level of substantive conversation or a little bit of research to the table, I think helps me as a board member, but trying to make sure that staff hasn't spent, 200 hours on that question is important. So the process one is something that I think we need to work through.
Yeah, thank you for that. And that is the related question, because we know we will get these kind of questions or project interest, outside of our approach. And what I'm hearing before we go into that question is and Commissioner Stoltzman did give us some resources that we could reach out to get some of these questions answered. And so I think it wouldn't take a lot of staff time to bring something back to you that's more form. And, Lexi, if you don't mind, maybe our staff could work with your staff as a way to sort of, vet the information we're receiving, if that makes sense. So if the board's okay with that, we'll take that little step. We're not going to come back with a thesis or a proposal, but we're going to try to get some of these preliminary questions asked, answered, if that makes sense.
I think that does make sense, Robin. I guess what I'm wondering is, evaluating the value of it depends on what the question is that we're trying to answer. And I'm not sure about that at this point.
I think, and others weigh in, I think the question we're trying to answer is that would this process provide us with viable data to either measure the use of fentanyl in our community, and would it stand over time as a metrics? Would it be an indicator of the success of any of these projects? And that's a huge gap to me, right? That's, I'm not saying that there's going to be immediate correlation, but given that we don't really have good data on fentanyl use, is it something that would?
Okay.
And Robin, I would just add to that. I think the process to get that information for me is really figuring out what other communities are using this and how they're using it, being able to connect with them and understand their concerns, lessons learned from them having implemented this would be helpful.
You bet. It's my understanding that the ability to test in this way was created out of a lab at MIT, and we have the contact information, so we can start there to see what other cities they're working with. So moving ahead, as these questions come up or ideas come forward, do you all have thoughts about, and especially I think we're talking about our municipal partners who have their own local priorities, how to bring those forward, and what that process would be. I know that, for the county and for the councils, it's sort of like a nod of 5, or as Claire said, you need at least 2 commissioners to bring forth a project. So I didn't know if there's any other thoughts that people have in terms of how this would come forward if especially a city had a specific request. And I know Harold's not on the call, but when we were looking at that grant opportunity, Harold made a decision to apply for the grant that did not come to the ROC. So that's sort of another just process example. And we know that grant opportunity will be coming up again. So I'll stop there and ask for your input.
I'll say that the city has one additional tool that people have not been using in the past, which is a nod of 3, not just a nod of 5, which the nod of 3 allows for if there's an additional desire to see just a little bit more research, and then caps like a reasonableness to that, which I guess is under my purview. But that seems like a little bit of something we're doing here with the fentanyl wastewater testing. Can we have a little bit more information before really going down the road and exploring it? And it seems like for some of these that may come up, and I don't know what will come up, that may be kind of a level of what we'd like before really committing resources to exploring something right off the bat, but offer that as a possible option to evaluate some of these requests. And again, they're going to depend on what kind of requests they are, right?
So this is, I have to caveat everything I say that I don't know a great deal about any of these things, but I guess my thought would be that the reason we have this ops group is to get some broad community expertise and advice on these things. And I would like to see us use that group maybe to initially vet some of these ideas. And again, not cautioning, we don't want to use a lot of time, staff time, or even the ops group time on things that are not worth pursuing. But I think, we have that group. We also have the substance use advisory group. And I'm just the last person on this screen to be able to contribute anything to whether we ought to proceed with something like that.
Kelly, I don't want to put you on the spot, but when you think of a process, what's your reaction to using the existing groups, and is there space on the work that they're doing outside of, the specific project identification, however that looks like going forward?
Yeah,
Yeah.
I think oh, sorry.
No, just curious what your thoughts are.
Yeah, I think in terms of using either the swag or the ops board, and I'm glad that, Claire, you brought up the swag, because I think it's long been a question of how do we integrate the expertise of that community coalition more broadly into the work of the opioid ops board. But I think in terms of folding in priority projects directly to that process, it makes the most sense to me, because it's one less duality to hold in what we've already identified is going to be a lot of different duality processes. So, we've got, the application process might be a both and, the timeline might be a both and I think if we can just start to streamline at least one primary element of this, that would be really helpful. So I would actually see it as something that I'm sure that group would like to sort of chew on and kind of take under their purview, because they're going to be having that contextual awareness of this ongoing discussion we're having about priorities. And so they can easily sort of absorb new projects and say, does this fit? Why not? Do we have the space to sort of do additional research, come back to the regional council with that additional research and, have a consensus to move forward or not? I think it fits for the operations group to kind of take these things on. The question that comes to mind for me is the most equitable mechanism to elevate those projects directly to the ops board. So I might want to think through that mechanism a little more, but yes, to your question, does it make sense to sit there? I think it does.
Thank you, Kelly. Any other comments about the process? And again, as we stated earlier, we know that this will evolve, and we will learn as these ideas come forward about what works and what doesn't work, or who gets their foot in the door around a question for us to research, right? And Kelly, I don't want to put more work on your plate, but I wonder if the AG's office knows what other ROCs are doing with this regard. I had heard that we're sort of ahead of the game, but maybe someone has discussed this as a process and in terms of decision making.
Yeah, absolutely. I'm happy to look into that. I know that the different regions have gone in kind of all different directions in terms of that initial question of like, are we doing competitive bids, RFPs versus direct funding? So it's probably the regions that have gone with more of a direct funding approach similar to ours that we would get the most rich kind of or relative feedback for what that looks like to advance certain priorities. So I'm happy to look into that further.
Okay, so I think we have agreement that staff will do some look further into this in partnership with public health and seeing if we can answer the question about what other municipalities are doing. You may have seen the chat from Barb Halpin suggesting that there may not be any cities doing this work, but we can explore that. And then I think in terms of the second question, we do want the entry to be the opioids group. And as always, we welcome any of the council members to bring forth issues or questions that you may not be seeing contained in the other work, because that's the reason why we meet is to have those kind of discussions. And especially often there are emerging issues that one council member may be aware of and others not. So want to make sure people feel okay about bringing questions forward. So I think that's the end of our formal agenda. We do have a little bit of time that we could give back, but we also wondered if there were any other items or updates from specific members that you'd like to put forward.
Robin, I can just share quickly. I think there was some information that got out that the Behavioral Health Administration may be aligning their regions around the opioid regions. And we did a little follow-up on that, and there's actually a different plan that's been presented that looks very different than that. But I just wanted to share with this group for people who may have heard that or been thinking that there was some option to align. It doesn't sound like that's actually an option that the state is looking at right now.
And Susan, do you mind giving a little brief context of the BHASOs and why this is important?
Sure. So the Behavioral Health Administration is a new department within Colorado, and they are looking at behavioral health administrative service organizations. And they have come forward with now 4 different options of how they would like to align these service delivery regions. And I think many of you are probably familiar with the RAIs that manage the Medicaid contracts for behavioral health. This will be separate from that. This will be a non-Medicaid service delivery system and have regional management of those behavioral health services. So the acronym is BHASO, or BHASO is some people are pronouncing them. And there's been a lot of different opinions about how to align those regions. It has been a bit confusing to me on why they're not aligning them to the RAI regions to try to align with how the Medicaid delivery system is working for behavioral health. There's some discussion that the state might be looking at wanting to change what the RAI regions look like, or those Medicaid regions. And they're putting forward several different options, now 4 different options of what those regions could look like. Some are splitting up the Front Range, some keep the Front Range together. So it looks different. I'm happy to send out those different options to this group. The most recent option that they put forward would have Boulder County paired with Western Slope. And there are some concerns about that. Broomfield, Larimer, and Boulder County would be paired with the Western Slope. So we are doing some work on that to try to bring forward to the commissioners some of the concerns that we have about that, and see what type of advocacy we could do. And happy to answer any questions, but that's a little bit of the background.
Thank you, Susan. I think as we've been talking about during this whole meeting, the environment is volatile, right? And changing. And there's so many external factors outside of our control that we're really trying to watch for. And Claire, I apologize if I cut you off.
Oh, no, no.
So we'll continue to look at the system issues and the statewide issues that might impact this work. We know that this is a dedicated piece of work, but it's linked to everything, and we don't want it siloed. And we know that one domino falls impacts the rest, so we'll keep track. Thank you, Susan.
Sure.
Robin, did you want to say anything oral about the reminder of the April 7th date here?
Yeah, so I think so this is that opt-in, opt-out thing about the new monies that Kelly referenced. And I think all of our major municipalities have responded. I think there are 4 of the smaller towns, and we'll continue to reach out to them. And Barb just put Superior, Lyons, and Jamestown are the 3 that have not responded. So did we get a response from Netherland, Barb? Sounds like we did.
Yes, just today, Miranda let me know that they put their forms in.
Awesome. So again, these are forms that cities and towns had to upload themselves to the state. We didn't really have a role, but we're certainly tracking it because it does impact the overall pool of funds.
And just to clarify, so these will be coming every time there is a new settlement. So the reason that they are needing to be re-signed now is because of the recent Walgreens and CVS settlement. So essentially this is all of the same. Every time that happens, every single municipality needs to re-agree to be a part of this and to accept the terms of the legal settlement in order to accept those dollars.
Would Jamestown, if these communities elect not to opt in for any reason, would that affect the makeup of this council?
I don't believe so. Per the IGA with the Attorney General's office, they had designated slots, and the cities, they had 3 slots to represent all the cities and towns. And that was determined that Nederland, Longmont, Boulder would have those seats. Claire, am I answering your question?
Yeah, I think you are, yeah.
And Kelly, the question that came up for me is, if they don't respond either way to say they're opting in or opting out, is there any vulnerability for us?
Yeah, so I do want to clarify, because I think we're moving 2 things into one document. And this was kind of confusing for a lot of the regions. So we just talked about it in that cross-regional learning collaborative that the COAC hosts monthly. So this is actually not the funding opt-in and opt-out piece. This is just a participation agreement to say, yes, we, Town of Nederland, would like to receive additional dollars from those settlements. That annual opt-in and opt-out decision will be put forward. I don't have an exact date, but last I heard they were looking at June or July as the annual period where they could opt in and out. So I know a lot of regions got kind of confused thinking this was the same thing. So to your question of how much that would move the funding, if certain municipalities leave or opt out and do take their funds, it's a relatively small fluctuation because there is a baseline number of what the region is going to get no matter what. So I think last year, I don't want to make up numbers, but it's basically the number that we worked with, which we allocated $1.8 million to different programs last year. And I think it was something like 1.4 or 1.5, and again, I can get exact numbers, was the regional share that we already had as our baseline. So that wiggle room of the additional 300 grand was really determined by the regional shares being opted in or out. So it will move the needle of dollars, but it's a small needle. It's a small movement if municipalities opt out.
Thank you for clarifying, and I expect you'll have to remind us again in the future when this comes up. So thanks for that, Kelly. All right, Commissioner Levy, would you like to close out the meeting? And
Yeah, I was just about to say, I think we have reached the end of our agenda. So yeah, I get the privilege of opening and closing this and letting everybody have 8 minutes back in their day. It's really been a great discussion. I want to thank everybody for active participation, and we'll see you on the next screen here. And I'm not going to even try to find it on my calendar, but I know we've got them scheduled. So great conversation, and take care, everybody. Bye-bye.
thank you.
Bye.